Hi, I'm Wendy. Welcome to Baby on Board. Today I'll be talking to you about babies born smaller than expected, otherwise known as small for dates babies. Sometimes during the pregnancy you find out that your baby is not growing as much as expected. It's called interuterine growth restriction and can be quite daunting for new parents. Often your obstetrician may decide to deliver the baby early and sometimes by caesarean section. If baby is delivered before 37 weeks, baby will be premature. After 37 weeks, baby is called small for dates. Mothers can feel guilty about this, but for half of these pregnancies there is no cause to be found. Smoking does increase the risk, so give up smoking if you can during pregnancy. High blood pressure during the pregnancy is a cause, but this is often outside your control. Most babies born at term weigh between 2.5 kilos, 5 pounds, and 4 kilos, 8.8 pounds. If your baby is born at term and weighs less than 2.5 kilos, that is 5 pounds, then baby will be small for dates. Of course, if you and your partner are small and slight, you are not going to have a huge chubby baby anyway. The main problem with small for dates babies are that they may have difficulty in keeping warm due to having less fat than usual, and the delivery can be more challenging as the baby is less likely to withstand the pressures of labour. Small for dates babies are often delivered by caesarean section for that reason. Due to baby's size, baby may have to go to the special care unit for babies and be kept in an incubator until their temperature is stable and they are feeding well and putting on weight. Special care units are daunting places, and when I worked in one, the most common reaction of parents was to burst into tears when they walked through the door. However, small for dates babies usually have no breathing problems and are often very hungry and put on weight quickly. Their stay in special care is usually brief. You may feel intimidated by the atmosphere in the special care nursery, so write down any questions that you want answered and ask anything that you are worried about to the medical staff. Their focus is to get your baby well and home. When you take baby home, which you can usually do when they are 2.5 kilos, 5 pounds, and the hospital is happy with their progress, you will need to make sure that they are kept warm. The room that the babies are in should be around 20 to 22 degrees Celsius, 68 to 72 degrees Fahrenheit. Babies lose about 85% of their body heat from their heads and face, so when it is cold, a hat is a good way to warm your baby up. Just use a hat when it is cold outside during baby's awake periods, as it is not recommended to have head coverings when sleeping indoors in their cot. A baby's temperature should be between 36.5 to 37.2 degrees Celsius and 97.7 to 99 degrees Fahrenheit. Keep your baby away from cigarette smoke as it is a cot death risk, and baby should always be put to sleep on their back as that is safest. Never use wheat bags, hot water bottles or electric blankets for babies, even if they are small. This is because that can lead to overheating. It is not recommended to sleep with your baby. Have them in a cot or co-sleeper cot close by. Small babies tend to feed more frequently, so once you get baby home, be prepared for a bit of a feeding frenzy. Feeding 2 to 3 hourly may happen until baby gets a bit bigger. Small for dates babies generally catch up by age 2, and some of them may do it sooner. If you found any of this information useful, please subscribe. It's free and you'll be notified of my next video. If you click or tap the video on the top left-hand corner of the screen, it will take you to another related video. Please visit my YouTube channel, Baby on Board with Nurse Wendy. See you next time.